Are you okay?
I've been coughing for 2 days.
I will take you to the nearest pharmacist.
Let's introduce our team members.
Hello, good morning. I am Asmoida. I will be the one for assisting you guys today. So, how can I help you guys?
Hello, good morning. My mom has a coughing a lot and has a runny nose. I'm so worried about her condition.
Oh, I see. So, ma'am, how you are feeling?
I'm just feeling slightly sadness, but I'm not
How long have you been feeling this way?
for at least 1 to 2 days.
May I know what is the suitable medication for her condition?
So, from her symptoms, I recommend her to take cough syrup with expectorant because it can loosen up the mucus in her lungs. Also, she should take nasal spray suspension because it can clear her nasal passages. Also, don't forget to let your mother drink some warm water like herbal teas or warm soup, so it can help to thin out the mucus in her lungs.
How will I use the nasal spray?
To use a nasal spray suspension, firstly, you need to shake the bottle before use. Then, take off the cap. If it's your first time using it, you need to press the nozzle a few times until a fine mist is released. After that, blow your nose. Hold the spray bottle with your thumb at the side. Tilt your head slightly forward. Place the nozzle into one nostril, keep the spray bottle upright and aim it toward the side of your nose. Close the other nostril by gently pressing it with a finger. Repeat for the other nostril. Avoid blowing your nose. Clean the nozzle after each use.
How many times should she take the cough syrup?
Here's how to use a cough syrup with an expectorant. First, read the label and check the dosage and instruction. Measure the dose using measuring cup or spoon provided. Do not use any kitchen spoons. Swallow it as whole as directed, usually every 4 to 6 hours. Stick to the recommended dose and do not double up if you miss one. Keep it in a cool, dry place away from kids.
Oh, I see. I will not eat down.
What if I don't feel better soon?
That's a great question. If you notice that your fever going above 38 degrees Celsius or you have been coughing for more than 1 week, you are feeling chest pain or wheezing, you need to seek medical attention for a closer look.
I see. That makes sense. I'll keep an eye on those symptoms.
Anything else we should avoid?
Yes, make sure your mother avoid from drinking cold or fizzy drinks, and also avoid her from smelling strong smell like smoke. And if you have any heater at home, please make sure consider a humidifier to add moisture to the air.
Thank you. This sounds great and easy to follow.
Thank you for your explanation. I will make sure she take all the medication, which is cough syrup and nasal spray, and I will make sure she take a lot of home water.
You are very welcome. If there is anything that you need, just let me know. I hope you will feel better soon.
Thank you. Saline nasal spray, cough syrup with expectorant and warm water are safe and efficient option for an older patient with a productive cough and running nose. Saline nasal spray is safe for elderly patients and has no adverse side effects. It is worked by thinning mucus to clear nasal congestion. In order to manage a productive cough, a cough syrup containing an expectorant such as guaiacin loosens mucus and helps its exclusion. Warm water helps the patient stay hydrated and encourage the removal of mucus. This combination is appropriate for elderly patients because it minimizes risk and while providing symptom relief. Through friendly and straightforward communication, the pharmacy assistant assisted the elderly patient in comprehending the treatment plan. The assistant gives a clear, safe instruction by describing how to use warm water, saline nasal spray, and expectorant syrup. The patient gains confidence in their ability to manage their condition after the assistant also explain when to seek medical attention, such as if the symptom worsen or a fever appears. Practical advice was simple to follow, such as avoiding irritants and drinking plenty of water. The patient felt supported by this method, which also motivated them to heed the advice in order to speed up their recovery.
We have chosen cough syrup with expectorant because the patient have a productive cough, which indicate there is mucus in her airways. The use of expectorant help to loosening and thinning the mucus in her respiratory tract. This was supported by research that I made from this website that mentioned guaifenesin, which is an example of expectorant, can increase mucus clearance and reduce cough frequency. We also chose nasal spray suspension because patients have runny nose, which indicate nasal congestion or rhinitis. Nasal spray, for example, saline or steroid base, help clear nasal passage, reduce inflammation, and improve airflow. This was supported by the research I made that mentioned saline nasal spray have been shown to improve nasal symptoms and reduce the severity of upper respiratory infections. From the video, I have learned how important good communication and counseling are for helping patients manage their conditions. Being clear and empathetic builds trust, and simplifying instructions help patients use their medication correctly. I also learned that explaining the benefits of treatment motivates patients to stick to it, while addressing concerns like side effects can ease their worries. Encouraging patients to monitor their symptoms gives them more control over their recovery. These techniques improve understanding and help achieve better outcomes, especially for elderly patients.
For elderly patients with a productive cough and runny nose, using a cough syrup with an expectorant and a nasal spray is a great choice because cough syrup with an expectorant can loosen mucus, making it easier to cough out. It also relieves chest congestion and helps clear the airways. Lastly, it is safe and effective, especially in older. Nasal spray can moisturize and clear nasal passages, as well as reduce swelling for quick relief from a stuffy runny nose. This combination targets both upper and lower respiration symptoms, providing fast relief while keeping side effects minimal. Good communication and drug counseling can help patients manage their condition by building trust between patient and healthcare community. Listen to their concerns and show empathy to make them feel comfortable and understood. Educate them by explaining the condition and how their medication works in simple terms. Encouraging self-care to the patients. Give tips on healthy habits like staying hydrated or tracking symptoms. Provide easy to follow advice and answer their questions.